What's up, good people? Welcome back to my channel, and in this video I'm gonna talk about a very interesting thing, which is glaucoma. As you have seen, I have talked about glaucoma in my other videos, but I want to bring a small and a very precise summary here for everybody who is concerned about glaucoma, that how do we diagnose glaucoma? We as a doctor, how do we diagnose glaucoma? And you as a patient, what would you expect from a doctor, from doctor of optometry or ophthalmology, that how are they supposed to do some minimal things that should be done, or the process that we most probably are going to follow based on glaucoma suspect patients, based on the precision, that how far you want to go into the treatment plan, and how much are you able to investigate based on the location. Also, sometimes it depends what sort of equipment you have available at that specific location that you're practicing, so it matters where you're going. So check out the technology and the perspectives that they are looking into to help out the patients, because it is a big game changer that how much technology are they using. For example, history is very important. Your doctor should ask you about the history, that what is the background of this specific patient that is bringing him into the glaucoma field. Okay, and secondly, intraocular pressure, the pressure inside the eyeball, is extremely important. Like at my practice, I screen every single patient for glaucoma. I want to check everybody's pressure of the eyeballs, and it's a very simple procedure. It's a very simple step that we take for every single patient, and it takes literally less than a minute to check the pressure of both eyes, and that's a game changer. If you find out high pressure, you can filter so many patients towards glaucoma suspicion and things like that. We are going to inspect the drainage angle. I check the drainage angle of my patients. Like I check the temporal angle, I check the nasal angle of both eyes for every single patient. So drainage angle is very important, and you can even ask your eye doctor that how was the drainage system, or how was the angle of mine in my eye exam today, and they would be happy to tell. And I do tell my patients if there is a point that they ask me, or if there's a point that I am talking about that in our discussion about the whole exam. Peripheral vision testing. In peripheral vision testing, I offer a couple of things to my patients. For example, for every single patient, regardless of any payment or anything, I have to check the confrontational field of vision. I check how many fingers can you count, like here, and stuff like that. Okay, you can ask me about details that how to check the confrontational field of vision, but field testing is very, very, very important. In any eye exam, you should test the field testing, and we call it confrontational field testing or confrontational field of vision. And another way that I offer to my patients at the clinic is about FDT. FDT is a very good and a very quick test to check for the field of vision, but of course, because it's a machine, so it might get charged to the insurance or to them as deductible and stuff like that, depending on the plans. But we do offer that kind of thing as well to every patient, whoever wants to be screened for field of vision, for glaucoma specificity and other perspectives of their eyes as well. And another important testing during the processing for glaucoma is OCT. OCT is my favorite because it helps me find out which part of the nerve is damaged, how much is it damaged, where is the patient at with that specific damage of the optic nerve head or RNFL, which is retinal nerve fiber layer. We look for all of those things in OCT and many things. It's a very, very self-explanatory as well as deep test that we can look into a lot of things with just one single scan of the eyes. It is, being a medical doctor as well, besides being an eye doctor, I know a lot of things about CT scan. You get CT brain, CT neck, and so on and so forth. You can CT any area of your body, but the problem with the CT scan was it could not do the exact deep cuts of the retina and the deeper part of the eyes. Yes, it will tell us about the socket, the eyeball socket, and all those things. Yes, the CT skull was able to tell us those things as well, but we needed a CT scan of eye. That's why we came up with ocular CT scan. So it goes in further and further depths of the eyes that are extremely important to monitor any patient with glaucoma suspicion, or any patient who is coming with glaucoma, whether it's primary open-angle glaucoma, stage 1, mild, moderate, severe. We do it for being an eye doctor. If I don't have at my place, I will refer that patient to a place that will have it, so that we are able to monitor the staging of that patient and treat accordingly, because it's very important to know where the patient is at, and then you treat that accordingly. Humphrey visual field is very important. The field of vision that I was talking earlier, the FDT, is like a screener, but this one is beyond the screener. It is still one of the gold standard tests for glaucoma, Humphrey field of vision, 24-2, 30-2, and so on and so forth. There are different types of it in the same machine that we can use to do certain other testing. And pachymetry is it's like a B scan. It's like a B scan of the front of the eye, but it does like an ultrasound part of the cornea, and it tells us about the corneal thickness, and from that thickness we can tell whether the pressure of 20 is a higher for you, or whether the pressure of 16 is a higher for you. So pachymetry is one of the favorite tests that I try to offer if I am able to, depending on the place I am working, depending on the equipment I have available, because not every practice has this pachymetry testing. But if I don't have at my working practice, I do offer them at some other referral places that have that. But because it's important, especially if I have screened somebody and on FDT screener and the IOP and history and the drainage angle and all those things are telling me that this patient needs further consideration, I will refer him to a place that has more testing if I have if I don't have all of them. So I hope this video helps you. If you have any questions, you can ask me in the comment section of this video, and please like, subscribe, and share to my channel. And thank you so much. Have a great day.